I don't know about you, but over the last year, we've certainly heard a lot of talk of resilience, a lot of talk of mental health and well-being, and we're not always sure that people mean the same thing when they use these words. So we just want to really set a ground level understanding this morning of what we're talking about when we talk about resilience. And today's really a chance for me and my colleague Alice, who's on screen, just here there on the slides. Give us a wave, Alice. Alice will be taking over from me in a moment. We just want to give you really an introduction today to a program that we're really very proud of, actually, and very excited about, Strengthening the Circle, an NDTI program for people who work with and support children and young people, purely focused on building resilience for children and young people. Okay, let's just make a start. We're going to introduce ourselves a little bit later. We're just going to set the scene really in terms of helping you understand basically what we're about when we talk about resilience and what the Strengthening the Circle program looks to achieve. Along the way, we'll introduce ourselves. So we'll get to that bit. Let's do the important stuff first. So we've given you our take here on the first slide this morning on resilience, focusing on children and young people. You can see there, resisting adversity, coping with uncertainty, recovering from and recovering more successfully as well from adversity, traumatic episodes, difficulties in life, etc. And we know as well, we've kind of taken some time to really pull together a lot of the research and what the research tells us about resilience. And you can see there that it's very clear, actually, when we look at it, that resilience isn't an end point. It's very much a process. It's a journey. It's never ending in many ways for all of us. You know, we're of course focusing on children and young people this morning, but we're really setting the groundwork, as people have been indicating, for things that people can apply as they move forward through their whole lives. It isn't just about getting through difficulty. It's about getting through it, overcoming it, and thriving, coming out stronger, better equipped on the other side as well. And that capacity, as several people have mentioned already, to withstand adversity, to bounce back from it, whatever life challenges are being thrown at us. And again, emerging stronger, more resourceful, better able to cope with life and everything that it contains as we move forward. And we know as well from the research, really clear, that resilience isn't just a one-type approach. It does involve this connected bundle of strategies, all working together to form a resilient system. It's not an isolated thing that involves individuals. It's very much focused within relationships. And of course, we all have relationships with others and with children and young people, particularly as our focus today. It isn't just about focusing on those individuals. It's about focusing on the relationships they have, all the many different types of relationships they have, and establishing a resilient environment and a resilient system that enables people to grow, strengthen, and become more resourceful. Okay, I'm going to hand over to Alice, who's going to take you through some details now about our program. Alice.
Thanks, Bob. Hi, I'm Alice McCall. It's quite useful, the point you've made about relationships at the end of that slide, Bob, because one of the things I think many of us know already, but is useful to just reflect on when we're talking about resilience, is that from infancy, of course, a core factor for building resilience is that secure relationship, attachment relationship with one primary caregiver. And as children grow up, their socio-economic status and family context shape their individual attitudes, which in turn has quite a strong bearing, as we know, on coping skills that they develop. So it's not all down to the individual, it's also down to, as Bob stated, the community around them and indeed their socio-economic situation, which I think is very pertinent at this time post-COVID, when we've learned so much about some of the adversity that particular groups face in relation to recovery and their experience of the pandemic. So the quality of contact with significant adults for children and young people can make a real difference, as we know, for them being able to cope and manage and to thrive in a crisis. And it can make the difference between thriving or experiencing mental distress in relation to a crisis. The evidence that we have, we know that it's perfectly possible within the constraints of social circumstances for everybody to develop more positive attitudes and effective coping skills, all of which help them deal with stress better. And again, I think it's quite useful for us to reflect on our own experience of the pandemic and the things we've had to cope with, and where each person, I'm sure, in this meeting has at times had to draw on some of their own coping skills to face change that we've been through. So I think it's useful to just reflect on these. The Harvard University Centre of Child Development developed these 4 positive processes to help children and young people develop resilience and better cope with adversity. And those are facilitating those supportive adult-child relationships. So really looking at how to make sure they're strong and that they are supported. And of course, we know lots of children had those separations from friends and significant adults, perhaps in their schools and in their communities during lockdown. Building a sense of self-efficacy and perceived control. So giving children and young people their own, enabling them, if you like, to have their voice heard and to feel their voices heard. Providing opportunities to strengthen adaptive skills. So helping children spot when they're adapting and then enabling them to really identify things that can come up, which could be stressors, and equipping them with tools to think about that, but also to counter those stressors. And the mobilizing of sources of faith, hope, and cultural traditions. So we feel strongly that this programme, Strengthening the Circle, certainly in the work that we've been doing, has got a lot, responds, if you like, to many of these processes. It involves co-production, which we'll speak about a bit more later, but really equipping staff with the skills to use co-production and facilitate that in all their work every day, you know, make it something that's the language of how they're working with children. And it's also very enabling for the children and young people. So the focus of all our work is around recognising strengths and making sure children and young people feel heard. And I've mentioned practical tools and strategies, which we'll come on to later. So just a bit about our context, and we know from seeing the list of people here today just how much experience there is in the room. So many of you will be very familiar with the context in which we're working, but I think it's worth just reflecting on that sort of pre-pandemic recognition, if you like, of the increased rates of children and young people's mental health, and evidence that, you know, 50% of mental health problems are established by the age of 14. So the window is really, really important in terms of our work and the timing for children and young people. And we also had data that came through. There was a document that many of you will know, Future in Mind, was a fantastic sort of publication in 2015, which really heralded shining a light on the issues around mental health and the research that showed just how behind, if you like, children and young people's mental health services were in responding to the level of need. And we saw that between 2017 and 2020, there was a 50% rise in the probable mental health disorders for 5 to 16-year-olds. So they were increasing at a really fast rate. And then equally, both during the pandemic, there were a number of really useful research projects. And now, and I say post-pandemic, as Bob says, you know, who knows when we're post-pandemic, but there's been some really useful information around looking at how young people have experienced this time and this issue around them flagging endlessly how difficult it has been to cope with life. Not for all young people, and we know that for some young people, lockdowns have been something that's worked well. I work a lot in adoption, and certainly for some children who have been in care and who've been adopted, that time at home has been very important and useful in terms of going back to those attachment relationships. But nonetheless, we know that the pandemic's put a huge strain on children and young people and families, as well as the staff who support them. And I've just flagged it up here, but I'll put a link in when we send the notes, because I think this new, literally out last week, Health Foundation COVID-19 Impact Inquiry is really useful, because it looks at the long-term implications of the pandemic on young people and assesses that how much greater support is needed for them as we move through into recovery. And we really want you to, at the very least, feel that some of the thoughts from today are triggering your role in recovery plans for children and young people. So concerns we've heard as an organisation working in, and I'll talk more about NDTI in a minute, but certainly on this programme, we've heard a lot more about staff being able to, the difficulty staff have in being able to respond to increasingly complex needs. It's worth flagging here a survey carried out by NASUWT, Teachers Union, and that highlighted the additional stress and mental health challenges of staff. 25% of staff had taken medication to deal with stress at work caused by the pandemic, and 12% had sought counselling. So, and you'll know this, I'm sure, from the staff yourselves, but also staff you're working with, just what a strain that's been. But also the difficulty staff have in, and managers and strategic leads looking for something consistent in terms of an approach for the workforce to use in their work with children, young people, families, communities, to build resilience and well-being and build on things that are already there, possibly. I think it's really important not to paint such a bleak picture that we're not recognising fantastic work that's already happening. And then how to integrate it, and how to integrate the right support at the right time, using tools into everyday practice. So it's not about sending somebody down a corridor to go and find somebody else to talk to. We had a recent meeting with a school nursing team where this issue was one that they felt in some ways they were at a disadvantage because they were the person at the end of that corridor. And really what they wanted to do was cascade learning on resilience to the whole team within their community, within the school. And then an approach that doesn't just enable children, but also increases the resilience of staff themselves. And that's been really exciting for us because we've seen some fantastic results in terms of staff benefiting from the training within this programme and leaving, if you like, more resilient. So a bit more about us, the National Development Team for Inclusion. We're a small not-for-profit organisation. I say small, we're national, but I think we are quite small. And actually, as a result of that, we're quite personal, and we tailor what we do for each of our commissions and for partners that we work with. And we're all about inclusion and equality of people at risk of exclusion. And the work we do crosses across social care, health, education, and communities. And an important element there is just for those of you who work on the SEND reforms, there's a sort of strap line of logos at the bottom, in particular delivering better outcomes together. That is a collaboration of different organisations, the Council for Disabled Children, our own organisation, and Mott MacDonald. And we run the Preparing for Adulthood programme for the DFE, which is really focusing on the SEND reforms relating to Chapter 8, very much around preparing for adulthood from the earliest years for young people who have special educational needs and disabilities. But we also do programmes across adults and adult with learning disabilities, mental health and older people. So we deliver training, consultancy, organisational development. We run a leadership programme for people who are working in the SEND area and indeed another leadership programme. And then we have a research and evaluation team, and they've actually been involved in some of the design of this programme, which I'll come on to later. So I think Bob and I just really wanted to acknowledge how varied your roles are today. So we've got people here who are working in the health service, commissioners, strategic leads, working in local authorities, running schools, managing direct provision, voluntary sector organisations. We've got some parents and carers here, which is great. And I'm sure many of you who are professionals are also parents. So, that's where a lot of this learning is so fantastic because it's so transferable into our lives. and people working directly with children. And I know a few people have come, you know, wanting to find out where a course is running near them. And it's just important to let you know that this today is a webinar about the whole programme. It's not going, you know, we're just giving you a flavour, as Bob has said. But in terms of what it can do, how it supports those different levels, certainly for strategic leads, we see Strengthening the Circle, because of how it's run, it's a programme, not a training course. It's got training within it. But the first stage, which I'll come on to in a minute, really assists people in a strategic role to think about refreshing and looking again at, it might be mental health strategies, it might be well-being strategies, it might be community strategies. But, you know, what's the plan in terms of recovery, and how is co-production going to be fundamental to that? And actually, we know the workforce needs to be valued and is valued, but this is something that we can, this is a tool, if you like, to really build that, the resilience of the workforce. And for managers, it's actioning those strategies and implementing COVID recovery plans. Again, sort of integrating co-production into delivery, so really using it to inform all the work on the ground and developing strategy. So when we show you the stages of the model, I think you'll see that there's potential for any course that's run to inform, as a result of the report and evaluation at the end, strategic development, because it's a continual cycle, and as Bob said, it's changing all the time. And then for practitioners, whether they're working in schools, and we'll come on to the different practitioners we've worked with in a minute, and this programme is really for non-specialist practitioners working with any children and young people, but it's really about them feeling proactive and equipped to support children's well-being, and just be using co-production, instigating it, spotting when it's really useful. And by co-production, I mean sessions with children and young people where they're informing the plan and they're voicing what they think about what's needed to help them maintain and develop good mental well-being. And there's a lot of our work on peer support. So we believe very strongly in, and then we've seen actually how effective it can be for anybody working in this sector to know other people and to be able to not only support them, but actually swap news, swap ideas, adapt skills, share resources, and indeed cascade training. And obviously the programme is all about supporting children and young people. And the reason we'll keep coming back to it is that by doing the work in the way that we've designed it, we feel we're also supporting resilient communities across all areas, if you like, of the workforce. So this is us. I'm Alice. So I've already said who I am. I'm the project manager for Strengthening the Circle, and I work as the Children and Young People's Development Lead at NDTI. And Bob is our associate who leads on Strengthening the Circle, and who has a wealth of experience on delivering not just mental health training, but actually working in community mental health. And we're sort of available to you as well as a result of you coming today to answer questions. Even if we don't do it today, we'll do so after the session. So it's carefully evaluated. This programme was developed through Health Education England, and as a result of that, it had a very comprehensive evaluation. That was in 2018, and the outcomes of the programme are for the workforce. So, and again, just to emphasise, that really can be volunteers, it can be parents, it can be community members, it can be volunteers. Very often it's school staff, people working in education, to develop their knowledge of resilience. And Bob will say a bit more later about the resilience framework that we use for the course. Ability to identify issues early. So just going back to that issue about the concerns we hear, you know, it's really worrying for staff if they don't feel, even if they do spot things, they don't feel they know what to do. So really working through not just spotting things, but knowing how to support children and young people and where to signpost should they need more specialist support. and just building confidence and skills, and a language, a common language around resilience. And one of the tools we use a lot is person-centered approaches. So increased knowledge of person-centered approaches and awareness and understanding of their own resilience as adults in that key role with children and young people. And subsequently, children and young people have improved contact with staff. They're able to manage their mental health better, and they're aware of their influence. So going back to this point about co-production, you know, they actually are involved, and I'll say a bit more in a minute about how we feel very strongly that we've been able to incorporate that into the programme. There's some quotes along the way which we've just thrown in, but this one's from a medical officer working in a further education college, and it's just a nice one because it flags up that issue around confidence. So as much as the course that we run within Strengthening the Circle programme gives knowledge and information, it also builds confidence to spot opportunities, to have good conversations with children and young people, albeit very short in some cases, but just spotting those and making the most of those, feeling like they know how to really build resilience. So we've got 3 stages to this programme. The first is a really important one, and it's the pre-course design. And that's done very much with commissioners, strategic leads, service delivery leads, head teachers, multi-academy trust leads, just really looking at what the content is and being able to hear what it is they want to use the programme for, because that means that we can tailor the content. Not drastically, but just enough to make sure that we're, for example, building in evaluation questions or particular speakers, perhaps from the local area or the community that we're working in, to come into the course, so that the people leave the course with a really good sense of what's in their area and what the plan is. And in doing that, we sometimes look through strategic plans. We certainly like to see the data and needs assessments in order to discuss how that works. We do keep pre-course surveys, which are important, and they, again, I think it's important to say they can be tailored so that we're really asking people. Bob's going to say a bit more about them in a minute, but actually everybody who comes on a course tells us more about what they're after, but also what training they've done before and what they're looking for. I think that's really useful, and it also helps us measure the distance travelled when we do a post-course survey. And then we deliver the course. So we've done quite a lot of work to prepare the way, and I slightly jumped over co-production in stage 1, but that's where we'd liaise with people in your local area to set up participation sessions with young people, and we'd be running those ourselves alongside staff perhaps who'd want to join us. And I'll say a bit more about the way we've done that in pre-pandemic times. But more recently, on an online delivery that we've done, we had so much demand by young people to come on a resilience session with us to give us their views that we had to run 2 evening sessions. And actually, some of them then came to the course and wanted to facilitate and ran very successfully a session for the practitioners on the course. So it was really a very strong model, we felt, to make sure their voice was, if you like, breathed into the whole of the delivery. So the course delivery, I know Bob's going to give more details later, but it's there. One thing to just flag is that individual tutor time. So as well as coming on a course, people on the course get one-to-one time, or indeed small group time, depending on what they want, with tutors. And we find that's a really important part of embedding learning. And we also encourage an online learning platform. We facilitate that. Rebecca, our business lead, supports that so that people are all constantly using it to share resources. And that's something, as we go on, we want to make into a sort of national platform for anyone who's been on a Strengthening the Circle course to not only feed into but access. And then the third stage is important because it's the evaluation and development, and we think this is really key. So, you know, that post-course survey and the learning that we get from learning logs and I'll talk more about change stories later, is essential really for pulling together learning to then go back up, if you like, to the strategic leads or the people who've commissioned the training and say, look, this is how the course went, this is what people got from it, and actually these are some of the things that we learnt that we think you'd find useful to know. And then just a bit more about co-production before I hand over to Bob. We've worked with a lot of different groups. I know John's here today, and John is actually in this photo, so I thought you'd be pleased to see yourself there, John. So John is a graphic illustrator and associate of NDTI, and he's worked with us on designing a lot of the resources and tools that we use on the course. And in this particular workshop, we were working with young carers, and it was a very interactive, if you like, session to talk with them about what stress felt like in this instance, and to create discussion and drawings, and from that, if you like, inform our own materials on the course. This group are there's one photograph of a group. They're young people who've experienced domestic abuse or had difficulties in their families, and again we did workshops with them. And the pictures are from young people in alternative education who when we're running co-production sessions, we're really asking the people in the room to say, you know, what is good support? You know, how does it feel when you get the right support from an adult? And what is it that adults can do to support you with your resilience? Because resilience isn't really a word, is it, that many children use? So we unpick that with them, but also encourage them to give us ideas. And we worked for quite a long time with a group in a special school who were due to leave and go on to college. And they got very keen on designing board games on resilience and creating tools that really are such a shame because we can't really use them at the moment. But there are such wonderful things that come out of co-production, and I think we've breathed that into the course, which is an important thing to share with the people who come on it. These are fantastic. This is Chloe's work. She, a young woman who's experienced quite severe mental health issues, became very, very keen to contribute to our materials, if you like, and she used photography, her passion, and this is actually her sister, and she created a storyboard. This is only part of it, to visually show her view of resilience and what it means. So it's up for grabs, co-production, but it's actually a really important part, and we would work with whoever we're working with to make sure it suits your needs. And I'm going to hand over to you now, Bob.
Lovely, thank you, Alice. Yeah, as Alice has just said, I'm just spend a few minutes really telling you a little bit more about the training aspect particularly, but just also to clarify who this program is for. As Alice has already said, it's for non-specialist staff, and examples of the kind of people that have already attended and benefited from the program. Certainly people working in the schools, definitely a whole wide range of people who, of course, are working directly with children and young people and may well have a role in supporting developing resilience. Health practitioners too, community-based health practitioners and school nurses are particularly a group who've so far found strengthening the circle really beneficial. Anybody really working again in children's services, face-to-face with children and young people, maybe even managing teams as well who are working face-to-face, of course. But let's not forget people working in the voluntary community sector. We already have great engagement by the third sector with the programme. But we've made sure as well that the entire programme has been designed and is delivered in a way that it also can meet the needs of people really at grassroots, parents, carers. It doesn't have to be people who have a job or a formal role of supporting children and young people and helping build resilience. We know that the training works really nicely when we have a mix of people from different organisations, and that might be something you're interested in, and we'll say a little bit more about that in a moment. But it may be you're starting to think about this as a programme that could be rolled out within one particular organisation, maybe your organisation, and to drive a culture of resilience through an organisation as well. And it can absolutely work either way. But you can see there are a wide range of people that can engage with this programme, and we know benefit from it. And again, quotes from people who've attended the training. You can see there people certainly do enjoy and feel they benefit from meeting people, maybe who have a different frame of reference, or working with young people in different contexts, and that sharing of experiences and expertise and knowledge and tools, etc., you know, is one of the benefits that people can take from the programme. What we've done with stage 2, the training part of the programme, is that we've mapped it against a resilience framework that's been developed by an organisation called Boing Boing. Some people here in the room may have heard of Boing Boing already. Boing Boing started really, grew out of a research part of the University of Brighton, and they've really spent, you know, a good long time now looking at resilience, pulling together worldwide research on it, looking for those consistent golden threads which really, you know, help pull the whole piece of work together. And then they've moved forward, developing a resilience framework. It's a non-hierarchical framework, and we like that. It gives lots of flexibility for people to address individual and group needs as well, in a flexible way, not having to follow things in a structured or hierarchical way. We also like the Boing Boing resilience framework because it's a strengths-based approach. You know, some of you may be familiar with trauma-informed programs around building mental well-being and resilience, or deficit-based models. This is very much a strengths-based model, and the evidence is really clear that we focus on strengths, and we like this phrase, and some people in the room use this, I know, and rather than focusing on what matters, on what is the matter, focusing on what matters. And we like this idea of, you know, this person-centered approach that builds on the positives, the strengths. So what we've done over the 5 sessions of training that is included in the program, we've structured those 5 sessions around the 5 elements of the Boing Boing framework, and I'll just very quickly name check them for you. The first part of the framework is called Basics, and there's a whole range of issues that we know are important if young people are going to establish and build resilience. Having good enough housing, you know, having enough money to live, being able to you know, enjoy free time, leisure time, you know, being able to move around and engage with public transport, etc. You know, the practical stuff that we know everything else sits on, have been well listened to, not being discriminated against. We cover these issues within the first part of the training. Just to let you know, anything you can see there on the screen that is highlighted in bold is a reference to a tool that we would be used in the training. There are many, many more, but these are just some examples of some of the tools that we introduce people to through the training. They're all, you know, provided to people. They use them, have a go at them in the training. They can take them away, adapt them, you know, to work for the cohort of people that they happen to be working with, share them with other colleagues, of course. And we find a lot of sharing of tools, and people's use of them and feedback on them happens within training as well. Week 2 of training, we move into the second part of the framework, which is something called belonging. And we know that a sense of belonging is really important for all of us if we're going to establish good well-being and build our resilience so that we can deal with the stuff that life throws at us. So we spend a whole session on belonging. And again, some tools there that we introduce people to, person-centered tools that they can then have a go at. We do get people to try them during the training, as well as take them away and try them later. Week 3 looks at the third element, learning, and that's not just learning in the sense of formal learning, but learning in its widest context as well. We know that establishing a good, healthy approach to learning and development, again, feeds resilience. So we spend a whole session looking at learning. Then into coping, and I think coping is often the bit that a lot of people our minds jump to when we think about resilience. You know, dealing with stuff, coping with it, coping strategies, etc. So this forms a core part as well of the resilience framework. And again, we introduce people to some tools there, explore the whole process of coping. And then the last training session, part of stage 2, looking at core self. And the feedback we get here, particularly from children and young people, is that very often people around them, parents, carers, professionals are focusing on helping them deal with difficulties they may be experiencing, but how rarely they get a chance really to take a time out to think about them, what their values are, what they're all about, what makes them tick, what matters to them, and then spend some time thinking about aligning how they go about day-to-day life, with what really matters to them in terms of their core values and sense of themselves. And of course, as people grow and develop, that sense of self also grows and develops. So feeding that core self also is a really important part of the framework. So they're the 5 elements that make up the resilience framework. And as we said, we take each week of the training to address each part of that framework. So by the end of the training, people have a full understanding of the framework. They have tools that they can use to conduct resilience audits and find where perhaps children and young people they're working with are in terms of their needs. And then they can explore understandings of the framework and try using some of the tools that can support engaging people and building resilience as well. And our approach to training, just to flag up as well, the training was originally designed for face-to-face delivery, but of course, like many people, given the year we've just had, we've spent time really morphing the training into something that can be delivered remotely. Our most recent training has all been delivered remotely, and the feedback has been great. I'll come to that in a moment. But the training uses a mix of approaches. Each week we provide information, introduce people to part of the model, some of the theory, and again draw upon that co-production that Alice mentioned, what children and young people in the local area, as well as nationally, have been telling us. And we introduce people to a range of different tools and models as part of that. We also each week get people to have a look at some tools. They won't have time to try them all, but they'll certainly try some of them, and we have different ways of doing that within the training. And again, encourage sharing of some of those person-centered tools that we introduce people to. We use breakout rooms, get people, directly involved in exercises. It's not a webinar like you're getting today. No, it is very much an interactive session. So we'll put people into groups of different types. We use a variety of different tools, something called WooClap there, where people can even take part in polls, quizzes, etc. So we've really taken time out to make the remote training as interactive and engaging as possible. And we encourage reflection as well. Each week, we encourage people to reflect on what they've covered, but also what they covered the previous week, and look at how that can be applied within their day-to-day practice. And action planning is a key part, both week on week action planning, having looked at a topic this week, what are your thoughts about what you want to do with that between now and next time we get together, but actually at the end as well, doing some longer term action planning, so that people aren't just coming away with some happy memories, they've actually got a clear plan as to what they're going to do with this. And as Alice has already said, it is based on that model. It's a structured approach, but it's very much responding to not just what the people of commissioners say they'd like us to meet, the needs they'd like us to meet, but also picking up individual needs and queries and issues as we go through the sessions. And just a little bit of feedback here from our last session, which was run in Dudley with a range of people from different agencies. You can see there the average scoring that we received on the training that was delivered. We are measuring both before and after a range of different issues. So you can see there over 21% increase reported across the board in people's knowledge and confidence about resilience and mental health. 23% people telling it, or 23% rather increase in levels of confidence and skills. So actually not just understanding the models, but feeling confident and able to use them as well. And again, a great increase in increased knowledge and experience of person-centered approaches, which we breathe through the whole training package. 100% of people say they definitely recommend the training to other people that they work with and know. So see there, more feedback from people really enjoying the interactive nature of the training. We've really taken time out to make sure that although it's remote, it still feels like people are getting together and really bouncing off each other and sharing the benefits of that.
Thank you, Bob. So just to finish off, really, in terms of impact, I mentioned earlier that we did a lot of evaluation in the first tranche, the Health Education England programme. And I think it's worth mentioning that our research and evaluation team use a realist evaluation approach, which we've used on this programme. And really that's about collecting change stories. So when it comes to measuring impact on children and young people, we encourage participants on the course to use change stories, simple, quite short, if you like, forms to record the changes that they see in particular work they're doing with children and young people. And we find this approach is a much more in-depth way to collect rich data, if you like, on social issues and sort of addresses some of the complexity, I suppose, of interventions and change programs that the formal sort of scoring SDQ perhaps might just kind of not to devalue that, but it's a different approach. It's much more qualitative, admittedly. So in this case, this young woman, Bethany, her support worker was on Strengthening the Circle. She's 17, and the issues that she faced and the worker was concentrating on as a result of the course, but also her work with Bethany, was poor school attendance. Family relations had really broken down, and the staff were seeing a lot more angry outbursts at school. And the family support worker was on the course and used tools, the inclusion web, used a tool called Good Day, Bad Day, and the relationship circle. So really helping Bethany look at who was in her circle of relationships to identify her strengths and the kind of things that she needed to concentrate on to develop her confidence. And the outcome was that Bethany's self-esteem and confidence increased. And she was evidently, her support worker was reporting on this, so we didn't hear directly from Bethany, but what was clear was that she attended school much more regularly, and her relationships with not only the staff at school improved, but actually the most significant change was that she was able to hold a supported discussion with her mum, and together they formed a plan to rebuild their relationship positively. And the family support worker felt strongly that much of that had been as a result of her confidence from the course to bring the right things in at the right time, she felt. So just to finish off, our costs for this programme, we can run the course for up to 12 people. We ideally, obviously it's good to have more, maybe up to 20 people. And that's the way that Bob has described. So that's the 5 sessions, the tutorials, and all the resources and the online support. The other thing that's important to mention is cascade training. So we know that many people come on the, if you like, the middle one, and they're very welcome to take the tools and share them with their teams. I mean, that's what we're all about, really. But cascade training is one that's got a focus more on really equipping people as well as doing the training to become trainers themselves. And we include a micro teach in that and a follow-up session about 3 months later, just to make sure that people are confidently using not just the tools, but they get the presentations and the resources and guidance on delivering training, and they get mentoring on that. I suppose most importantly, it's worth saying that we're very interested, as much as we are keen to provide the programme, we're also quite interested in learning about your own contexts and the things that you're thinking about for recovery for children and young people in your area. So even if it's just picking brains and flagging thoughts from today, we'd really welcome contact with you. And, you know, we're very much available to you should you want to come back to us.